actually this is a very important topic. Working in ICU on a daily basis is very challenging to maintain infection control measures. We have high turnover at all levels, resident, nurses, RTs. I think the physicians also should play a major role in leading infection control in ICU, being a role model for the staff, okay, instructing them and sharing with them the importance of taking these measures is really paramount in such practice. Yes, the sessions will have an impact, but as a physicians ourselves, we definitely have big responsibilities in maintaining infection control measures in ICU.
Thank you. Let me just take one more question. We're running out of time. Just one more question for our attendees. In your hospital, do you have a hospital-approved antimicrobial guideline? Please vote. Okay, so again, majority have hospital-approved guidelines, so I don't think we need to discuss this a lot. We'll discuss it with the other question. Do you have an established antimicrobial steward program? You? Please vote on the other one. So I think we have a trend for favorite actually answers in those two questions. So if any comments from the attendees, someone raised hand, any hands, any comments?
Dr. Mustafa?
Yes, Dr. Ali.
I think it's very, very important for the antimicrobial stewardship program to be established into the institution, and especially in high risk like ICU or in high risk units like transplants or nephrology ward or those areas that are dealing with oncology or transplant. Not having it into the institution or into the unit, there is national movement now to have a call, what do you call it, center for these questions that could be delivered from a healthcare practitioner asking about antimicrobial stewardship program. So I would encourage people to be looking into this, call center to have it either in the region or into the Ministry of Health web 937. If I remember right, Dr. Majid is with me in the National Antimicrobial Stewardship, in the MDROs. There is a movement now to put a number that they could call and ask for a decisive answer regarding antimicrobial for certain multi-drug resistant bacteria.
Thank you, Dr. Ali. Dr. Faisal, any comments?
As you said here in the questions, it is a program, so it is a multidisciplinary subspecialties that is involved. And the most important in the ICU, it's you need to have specialized clinical pharmacist who has interest and time, dedicated time actually for the activity of antimicrobial stewardship. So it's important. It's needed to have a weekly meetings. What we are really doing in our hospital is we have a round table every week with our colleague in the ICUs, including ID, infection control, ICU, clinical pharmacist, and this is usually led by clinical pharmacists who is specialized in ID and antimicrobial stewardship, and they bring the list of all patients that need to review all antibiotic. As you know, all ICU patients, they are on at least 2 antibiotic, and one of them is carbapenem, and the others is colistin. So it's very important and crucial to have such a program. and it's a requirement now by GCI, Subahi. So even we encourage I don't see that our ID fellowship, they have dedicated electives or dedicated rotation for stewardship. But I think in the next future, this will be part of any ID fellowship in our local program, inshallah.
Well, we can have we have a time for one more question or comment. Yes, at the back.
Good morning to all. The comment on this is about the established stewardship. Most people assume that stewardship is equal to antibiotic restriction only. So I think the 72%, including me, sometimes we confuse with that as the stewardship program. It has many other components, and I'm sure many hospitals don't have it.
Well, we'll take in, so the stewardship is not really just having restrictions of antimicrobials. This is a whole program where you have basically to do lots of things, including review of many antimicrobials, review regimens. But to start with, you have to have some guidelines to guide people on how to use the antimicrobials. And then you have to evaluate how the prescribing is being done and give feedback. So the feedback is very important to tell people how they're doing. And there should be some metrics to decide on the utilization of the antimicrobial stewardship and the success of the program. Unfortunately, we have to end up here because of the time. There will be another interactive discussion with Dr. Zainab, and that will be more focused on infection control, so please stay with us. I will call now thank you, Dr. Ali, thank you, Dr. Faisal, thank you for being with us this morning. And I would like to call to the stage the moderators of the next session, Dr. Ayman Al-Jammal and Dr. Badr Al-Saif, please.
Bismillah ar-Rahman ar-Rahim. First, I would like to thank our colleagues in the scientific committee of Al-Musa Hospital to invite all of us to this outstanding meeting for infectious disease. This is the third time to arrange for this meeting, and all of us are honored and privileged to be involved in this very important meeting. So our session will be about the device-associated infections in ICU, and we are privileged to have our three speakers here. So our first speaker is Dr. Abdurrahman Al-Udayani. Dr. Abdurrahman is a consultant pediatric infectious diseases, formerly head of the Division of Pediatric Infectious Diseases and clinical assistant professor, director of infection control and Center and Excellence, and deputy chairman of the Infection Control Committee, Prince Sultan Military Medical City, Riyadh Hospital. Dr. Abdurrahman. The topic will be about how to improve the CLABSI rate in the era of